this important meeting, and congratulations for this really impressive meeting. Let me just present maybe Amgen in few words, and let's start then to maybe initiate discussion about the topic, which is localization, biotech, and other words. Amgen is, I think, is an idea. It was in 1980 when some top researchers from California universities were they were with the business angel and decided to build a new business called biotech at that time. And their vision was to see the biotech will be the future of the pharma. And they built a company called, at that time, Applied Molecular Genetics, which is Amgen today. And they start by isolating the first epogen, and they built from US and then expansion in the rest of the world from the growth factors, and then they expand their search and research in other area. Amgen, as a company, it's a biotech leading company, of course, founded in Thousand Oaks in California in US in 1980. We are delivering more than 26 billion a year in terms of revenue and reinvesting 4 billion every year in the R&D to discover and develop new molecules. We have a presence in more than 100 countries, of course, with important presence in Middle East and Africa, and in particular in the Kingdom. And we have today 25 drugs available in the world, and most of them are registered in the Kingdom. Our focus today in terms of development and portfolio, we are, of course, our DNA is from the oncohematology, of course, but we developed as well a portfolio in the bone diseases, in cardiovasculars as well, and in the inflammation and nephrology. After that, we are developing a portfolio and a pipeline of biosimilars only in biologics and in our areas like oncohematology or inflammatory or rare diseases. I will have some, maybe here, just one, in 2 minutes, presentation regarding the supply chain. I will copy maybe Shakespeare here saying the supply will be or not to be the future of the pharma, because many countries today are looking to secure their access and medication for their populations, and today they are competing in acceding to the innovations, but to the treatment as well. And this will be, I think, one of the most important challenge for the pharma, but also for the countries to develop this, let's see, sovereignty in terms of securing access to their patients. It's one of the top priority for Amgen today to invest in operations and supply chain. Our claim is to say every patient, everywhere, and every time. We invested more than 2 billion the last 5 years in improving our operations and supply, and just a few weeks ago, we announced as well an additional investment of 1 billion to solidify our supply for the future. This is just a report, because when I say that we are focusing on that, we are really proud that this is in US. Amgen was ranked on top pharma without any shortage in US for the 5 years from 2011 to 2015, and we continue, and we have exactly the same for all the country where we are operating. For us, every patient, every time is very important. This is something we are working on it every day. Of course, this is maybe for the discussion today, how we are securing our supply. Of course, Amgen, you know that biotech, the one manufacturer can supply for all the countries, or because sometimes we are operating with a drug, maybe treating 100 patients, or for example, in the cardiovascular, today we are talking about 20,000 patients or 30,000 patients, not more. We are not in a mass market where we can have a manufacturer everywhere, but the most effective way to secure the access is to have the plants of the substance active where we need to supply for the rest of the world. And this is the strategy today of Amgen, is to have a principal site for a drug, and always having a backup site in other sites, different countries sometime. And even for some ingredients, for example, for some supplier in China, we request them, if they want to be partner of Amgen, to have 2 different sites in case one site have a problem, to be sure that the second site can produce the ingredient. This is exactly our focus and our battle every day to secure the access everywhere. The second one is, of course, investing and being a partner locally with the medical community and the policymakers to be sure that we are looking to the local need and being the facilitator or the tool to improve the outcomes for the patient in the country. Here, I will not detail any of those solutions, but we developed many solutions like PSPs, like for the oncohematology. You know that with the customized medicine, we need more testing now, and we are investing a lot in testing and for testing and identifying the right patients. Also, we are connecting the medical society with the international medical societies to build sometime the excellence centers, for example, for bone here. And this is every day. The idea is yours, it's not our idea, and we are here just to facilitate and to transform the idea into concrete actions. More than welcome to respond to any question if you have. Thank you so much.